Stop him.
That's right, yeah. That's right.
You might want to pull your tie from the bottom.
Okay. For mine? Oh, okay.
Okay, so that straight now.
As I grab your shirt and see your tie. Can we get a mic check for me, please?
Sure. 1, 2, 3. Testing. 1, 2, 3. Testing.
Good, thank you.
Impact of poverty on African Americans.
Okay, that sounds good.
Let you go from there.
Okay.
You have 30 minutes.
All right.
And so however you want to use poverty here or whatever.
Okay.
And we'll sort of develop it as we
All right.
go along.
Okay.
Don't do no Gregory Taylor.
All right. Now, see, that's still the impact. He does.
Still on my mind.
He's still on your mind. Oh, the impact here. Yeah, you got to let it go now.
Yeah, I can't.
Showtime.
Yeah, it is showtime.
Ain't it time?
Okay, God is good. Okay, Dr. Sanford, EKSanford1, Tennessee State University.
Yeah.
Still want to be known?
Yeah, that'd be good.
Okay.
Yeah, I'm saying they still got me there. They treat me bad, but they
Hey,
got
I
me
tell
there.
you,
You know how they do
I
you.
was there for 30 years.
I hear you.
know
You
exactly
know
how they
that.
do.
Yeah.
Okay. All right. Anytime we're ready.
Yeah, you're talking promotion, yeah.
Okay, no problems. We're just trying to. This is the last show for today.
All right.
I can get out of here. Then.
I'm supposed to look at you now, right, when we're
Yeah,
talking?
yeah,
Okay.
just watch me.
Is the chair okay? Okay.
Yeah, just. Yeah. So the first segment will be 6 minutes.
Okay.
And then we'll take a break, 2-minute break, and then
Yeah.
8 minutes, and 2-minute break, and then
Okay.
10 minutes.
All
2-minute
right.
break. You got that? 6 minutes, 2 break, a minute break, and then 8, and et cetera, et cetera. And so let me know when we get 2 minutes into each of those segments. I mean, 2 minutes left. Thank you and welcome to the show this morning. The topic this morning is the impact of poverty on African Americans. And we're fortunate to have with us to talk about the impact of poverty on African Americans, Dr. EKSanford. Dr. Sanford is a professor at Tennessee State University and has been with us on a number of occasions. And so, Dr. Sanford, let me welcome you to the show this morning and to say up front that I'm sure that many members of our audience know you quite well because you've been with us on a number of occasions and you've given us excellent information, sociological information especially, and so we certainly appreciate that, and we're glad to have you here this morning to talk about the impact of poverty on African Americans. But before we start that, Dr. Sanford, let's see if we can talk about Dr. EKSanford, to have you to give us some statements in reference to your background, your education, and some of your experiences. And then at the end of this first segment, we'll come back and we'll start dealing with the impact of poverty on African Americans. Let's see if we can do it from that perspective.
Okay, and thank you very much. It's always a delight to be here. As you've already noted, I'm EKSanford, professor of sociology at Tennessee State University. I did my educational postdoc experience at the Penn State University in State College, Pennsylvania. Proud to say I did my doctorate degree at Howard University in Washington, D.C. While there, I had some wonderful experiences that I think will contribute to this morning's conversation. I worked at the national headquarters of the American Red Cross doing evaluation research in HIV/AIDS and education, which I've also contributed to here in Nashville, Tennessee, Davidson County, on that same project with Meharry Medical Center. Also, I worked at the National Organization of Black Law Enforcement Executives while I was working on my doctorate degree as well. I did my undergraduate degree at North Carolina Central University, where I'm originally from, of Oxford, North Carolina, and also at UNC in Chapel Hill, where I'm very proud to have had that experience as well. And then as you just mentioned, I'm a professor of sociology at Tennessee State University, and I've been there for, I guess, close to 20 years now. Yes.
And with a lot of information, Dr. Sanford, I must say up front that you've got so much information and you've done so well in terms of distributing that information and encouraging others to follow some of the information that you've given us. And so I just want you to know that up front.
Yes.
Let's see if we can start talking to, make some statements in reference to this idea of poverty and the impact of poverty on African Americans.
Okay, I'm gratefully. I would like to try to mention an observation of a piece that I've just been working on sociologically, a colleague of mine this summer on obesity rates among African Americans. As you may very well know, throughout the United States and the South, the obesity problem is a huge issue and concern. Over $147 billion is spent each year with regard to obesity rates. That rate is disproportionate to African Americans, and what we found in our research that is disproportionate in relation to poverty. Lower income people have a tendency to have to eat a lot of trans fats, dietary types of habits that are not totally healthy for you but are more filling. And this has been a problem. But I would like to try to place it into a historical context of 1619 of slavery for 244 years leading up to the present, where these types of things have become very cultural. In many instances, some of the dietary habits that might be very present within the culture of the African American experience are linked to that earlier time period. We endearingly may refer to it as soul food, and many of that type of dietary habits now we found contributors to some of the poor health that is present. So from that earlier time period of slavery, to hundreds of years leading through Jim Crow laws and segregation, we found issues of poverty that has led a group of people making up 12% of the population still today, largely into a cultural poverty, I might say, that have brought about certain contributing factors that might be related to health and wellness in a very negative way. Now, interestingly, in our research, we found that, unfortunately, not only is it for the low income members of the African American community, but in many instances, even in the middle class and upper middle class and upper class of the African American experience. Why? Because it's related to culture and eating habits and dietary habits. And so some of the foods that are endearing to that particular community, people may still indulge in it in large and disproportionate proportions. So we find hypertension, high blood pressure, issues such as heart attacks, diabetes, that are larger part of society is still disproportionate to the African American community based on poverty.
And of course, I think that what we'll do now is to make preparations for this first commercial break, and then we'll come back and we'll pick up at this point, and we'll be back with our audience following this very, very short commercial break.
Might be related, I know, such as crime, delinquency.
That's good. That sounds good.
Socioeconomic status.
Goes well. This is going well. It
all
goes
that.
well. I like this.
Yeah, but I know we just right over at this university this time, they gave, it's the research and sponsor research. They had a call it was almost at the end of the semester, and gave us 2 weeks to come in and work from Monday through Thursday just on a research project. And we have been working on this, doing panel discussions for a number of years now. But you know how it is, when they're teaching 4 or 5 classes, you don't ever have an opportunity to put it together. So they gave us an opportunity every morning from 8 to 3, and they provided us with lunch to try to pull together your research. And so it was an interesting thing, But what I meant by that, I didn't want to get into it, but you can look at some of the overweight and issues even in the upper class. You know, when you have a lot more money, then you can buy a lot more food if we're eating the same thing.
Same thing.
That's right.
That's right. It's still pork.
That's
whatever
right.
it is.
That's right. It's like Oprah. You know.
This is an 8-minute segment, right?
Yes.
And you're going to give me 2-minute warning before. Okay. The impact of poverty on African Americans. And we have a lot of it too.
There it is.
Thank you and welcome back to the second segment of the show for today. We're talking to Dr. EKSanford from Tennessee State University, and he's talking about the impact of poverty on African Americans. And so, Professor Sanford, let's see if we can pick up where we left off the last time and to give you an opportunity to further develop some of the things that you're saying in reference to the impact that poverty is having upon African Americans. Let's do it from that perspective.
Okay, well, thanks so much. In that last segment, we made an effort to try to contextualize the aspect of health disparities among African Americans, and we find that it's disproportionate in comparison to others. For instance, when we look at the data demographically throughout the United States, for instance, the state of Tennessee, we are ranked like number 3 in the nation in overbeats and overweight issues that will then cause chronic illnesses. So when you control for race and ethnicity, you find it's disproportionate for certain ethnic groups, although it is also a problem for the total population. Some of it is certainly a part of Southern culture, but still disproportionate for African Americans, not only in the southern states, but throughout the United States. Interestingly, the present candidate, Hillary Clinton, is also looking at issues related to disparities economically among Americans throughout the United States. And I think there's a strong notion even there that different ethnic groups are certainly experiencing this disproportionately. So when you think in terms of income and how income and living in poverty impacts people's lives, it always brings about a lot of ills within that particular ethnic group, whoever you may be. And so African Americans in many instances are very disproportionate, Native Americans, Hispanics, other ethnic groups. If they're disproportionately related to education, and then that's going to impact, of course, the low income. As you may very well know, our national president right now has made every effort to try to raise the minimum wage to $15 per hour throughout the United States. And even if that becomes law throughout the United States, and when you think in terms of the rates and how expensive it is to live and to live in a healthy, good quality of life, that still puts a person in a very disproportionate type of fashion in relation to education, in relation to health, in relation to maintaining a family, in relation to raising a child and socializing them in the correct way. So when we look at some of these disparities in the United States, they're very strongly related to the culture of poverty.
And so there's no way around getting over the fact that African Americans are disproportionately impacted by poverty, as I think as you're indicating.
Yeah, absolutely. And historically, we can see this from an earlier time period to the present. There have been a lot of inequalities that have existed within the system. And when I always talk about social structure, I'm thinking about the main institutions that make up society, such as economics, such as the family. And when you look at economics and how that's related to the family, and if economics is not going well, if you have a high level of family breakup. When you think about medicine, I know we have a national health care policy right now, but that's always been a problem. When you think about other types of institutions within the society we live, it's always disproportionate. It's been linked historically all the way to the present. That's not to say we don't have a growing middle class and an upper class. It's like every other ethnic group might have, but it appears when you look at the statistics that any of the chronic illnesses for the population size of African Americans is still disproportionate, and we can contribute that a lot to the culture of poverty. Some of the ills may even be contributed to certain deviant behaviors that might still exist disproportionately. When you look at the prison system, when you look at youth and then violence, when you look at issues such as overweight and obesity to type 2 diabetes to younger people within our population right now, but still for African Americans, you find that it's disproportionate. So these are some of the issues that's just as strongly linked to poverty and culture within our United States. And I think we have to have leadership that is very much sensitive to that as an issue. Just this notion of a culture of poverty. In many instances, people might just wonder, well, why don't people just do a little bit better? Why does it continue to exist? It seems like it's a perpetual problem that continues to exist on and on and on. But there's something that exists just within poverty itself that it becomes a part of the culture and people adapt, and then it's hard to break that cycle. So we have to have sociologists, psychologists, people in political science, all working in unison to try to make an effort to better these conditions within the institutions to improve for human beings.
You know, we had an earlier show dealing with, excuse me, with African American youth.
Yes.
Now, what impact does poverty have upon African American youth?
Oh, that's a very important question, and it impacts negatively, unfortunately. Given the fact that it is disproportionate, and as you have people who are born into the culture of poverty, I think there's no parents, let's say a mother, that would want to have a child and want them to have deviant behavior. But what happens when they grow up within that particular culture, and that culture perpetuates, say, deviant behavior, and what they are around is that, and without an educational support system, without the extended family that is broken down today within the African American community, you find that violence, bullying, you find that different types of deviant behaviors that get people in trouble earlier, being a part of gangs, all of those things become a part of the culture. And in many instances, when one wants to stress, say in the school system, to do really good, it might not be very popular to try to go to school and to do your best as it was in the past. Long time ago, within that same, say, African American community, you may have had what Carol Stack would refer to as fictive kin. People just within the neighborhood that you might call uncle, aunt, and big mama or big daddy. All those people would have had an impact on that particular child. In today's society, those same people are not present anymore.
You know, when we think about poverty, Doctor, from your perspective, would it be cost efficient if we believe that poverty has something to do with the economic status of African Americans? Would it be to the advantage of the federal government to provide some kind of job opportunities so that African American youth might be able to overcome some of the challenges that you're talking about here?
Yes, absolutely. And I think I've heard this from the new leadership that will be probably coming up in 2017, at least from the potential candidate Hillary Clinton, mentioning that as an economic disparities and recognizing, you have to recognize a problem exists before you can think about doing something about it. And I think by recognizing it, wanting to try to implement some type of programs that can help will certainly be impactful.
Okay, very good. And so what we're going to do, we're going to take our final commercial break, and then we'll come back and we'll pick up at this point and talk about what might be considered some of the solutions to some of the problems that we're talking about. And we'll be back with our audience following this very, very short commercial break. Heard that other man.
Oh yeah,
My goodness.
I know. I can't believe it. I can't believe that Donald Trump came out.
It's going to be something else.
It's
going to be a political season
it
that you've
really
never seen
is.
before. If he makes the debates and whatever, we can really expect some strange kind of sayings and whatever next time. As a matter of fact, well, anyway, we have to deal with it.
We have to deal with it.
But when we come back, what we want to do is to think in terms of, and that's been my big thing. My big thing is that if the government or somebody, state, federal, or local, or whatever, can provide. See, most of the problems that we have are connected with the economic status of young men, of these young men, and you can't have any kind of solid foundation if you don't have. A job or something, some kind of support, because everything is connected with. A man feels much better.
Absolutely.
If he's got a job.
That's right.
You know, I mean, if you've got a job, you don't want to stay out all night and do everything. You want to come home and get ready to go to your job because you know that somewhere there's some compensation coming.
That's right.
And so I think that, and that's why I'm heavy on this. That the government ought to really get involved with giving some of these young people a job, because I think it would certainly be much more cost effective. And anyway, we've got 10 minutes.
Okay, the other side tries to pull away. They like to try to look at them the set asides and all of that. They try to take away from Head Start and all that.
Well, it might take away from incarceration too.
It would, absolutely.
That's a real problem.
Yeah, I'm telling
With
you.
a young man in solitary confinement, you
Oh,
see
man,
about
yes.
how in the world can you keep
40-some years.
somebody in solitary confinement for 40 years?
Yeah, absolutely.
Thank you and welcome back to the final segment of the show for today. We're talking to Dr. EKSanford, and he's giving us some information in reference to the impact of poverty on African Americans. And so, Doctor, the last segment, we talked about the impact of poverty on health and other aspects, but let's look at it from an economic point of view, the impact that it has and it might have on individuals who are unable, for whatever reason, to find a job. Let's do it from that perspective, from a sociological perspective.
Absolutely. I think sociologically that is one of the key variables in relation to being in a culture of poverty. Indeed, it says that you don't have the income to have a certain type of a quality of life, and not having that quality of life is contributing strongly and significantly to lacking of education, lacking of having opportunity, lacking of having the quality food that is needed, the lack of having both mom and dad and other support systems in place to help a child that is born to be able to just move through and matriculate through the school system to then do well. I think, as you and I know, we look back in history, sometimes the school systems that had a vocational type of a background would always make sure that students could maybe leave half day, get some type of a training, and then be able to come out at the end of high school and get a job. But now we've moved into a highly technological postmodernist age where now we need a whole new skill sets, and education is becoming primary for people to be able to advance within the society in which we live in. As we move from an agricultural stage to a highly industrialized stage, machinery, computer, technology has taken over. And you just don't need that many men to go out, or women to go out into work where the machinery can take over. So we need to be very aware that economics is very much related to jobs and opportunity within the family. And with that family breakdown, it becomes a part of that culture of poverty. So I think if you think on it on a national level, and I think our President Obama has done an excellent job in giving thoughts to education for all kids, pre-kindergarten and kindergarten, trying to stabilize it for not only those who can afford it, but those who can't. That's touching on poverty again. Healthcare system for those that can't. That's touching on poverty again. When you think in terms of Dr. Kennedy, who used that school system up in New York University, just the state of New York, you find that in those 74 blocks of poor areas, he has a particular school there where he brings in a particular system that is inclusive of everything that a student would need. And so in the early education, he would bring in all of the family members, tell them they have to be very supportive of the child. He would have food there, he would have health there for them, any type of assistance they may need for their health care. And they have an excellent rate of graduating students. So I think that's kind of a good model when you think of how something like that could be implemented on a national level so that things could be improved for those who live in low-income areas.
And in other words, if we don't do anything, and I think that's essentially what we're doing now, that things are not going to get any better, nor are we going to save any money. I think that many people object to what the government investing money into many of our young people, black or white.
That's right.
Without recognizing that it is more cost effective to invest money on this end than the other end, which might lead to gang violence, incarceration, murder, and all of these things. And so I think that that's a real question that we have to answer and deal with as a society. Would you go agree with that?
Yeah, very well said. And I think you're absolutely right. I think we really in this postmodernist age have to get some very strong talk and some very strong ideas on how to solve some of the problems, education and economically. Because as mentioned, if you don't do it on that end, there are going to be other ills with other society that will be more costly. You know, I think on average, for a person that's incarcerated, it's going to be $30,000 a year. If you invest in the education of that child earlier, it'll be a lot less, and then they can be productive to help society to be a better place for everyone to live in.
That $30,000 a year for incarceration is literally pouring money down the drain.
It really
is. Of course, the purpose is to make society safe and et cetera and et cetera.
That's right.
But that's a waste of money in terms of what could be done with the same amount of money if you were to use it on one end, on the other end.
That's right, in education, or in the family. Or trying to improve those neighborhoods and economically, to put people back to working and give them good opportunities. It would be used certainly in a different way, and it would help society. Yes.
You know, earlier I was involved with another program called the Job Corps program.
Oh, yes.
And as a matter of fact, I was one of the first instructors involved in that program back in 1965 when I graduated from A&M College in Pine Bluff, Arkansas. And we found that program to be very, very effective in terms of helping to meet the needs of a large number of urban and rural young people, not only Africans, black and white, but and I understand that the program is still viable today, but there's not that much said in terms of what was done and what could be done with such a program. Now, and what do you think about those kinds of programs?
I think those type of programs are very vital. You know, CORE, if you had Head Start, but when we listen to our politics sometimes today, we feel that, or we hear that one side is always looking at that as money we need to take away. And I think, as we just said a few minutes ago, in those types of programs that have shown effectiveness, they certainly need to be put more into it so that they can help those people, and all across all ethnic groups, even the majority group, because it's definitely related to poverty. And poverty, whether you belong to the majority group or the minority group, is going to impact you in the same way. Poverty is poverty.
That's what poverty is.
That's right.
It really doesn't care about personalities. If you get involved in poverty, you are caught up in poverty.
You are caught up in it.
And might be more one group involved in it than the other, but that really doesn't concern you if you are individually caught up in it.
Absolutely. So I think having innovative programs like that would be very effective. Now, there are some out there with the Robert Wood Johnson Foundation and the Bill Gates Foundation that's trying to come up with innovative ideas of helping some of these types of ills within society, from obesity rates to improving education for contemporary society in which we live in, which we're really needing at this point. So I think there are some innovative things out there that are going on right now. But yeah, I think those types of programs that we've had in the past, if they could be strongly contributed to, they could really be effective today.
And especially if we could get some jobs, some construction jobs, or some kind of activity that would use many of these young people to do something that is constructive and that helps society as a whole, then I think that would be quite a movement to make for not only the government, for private enterprise and et cetera, because I don't think that we have to, living in the greatest country in the world, I don't think that we have to have the amount of poverty and unconcern and uneducation, incarceration and et cetera. I think that we could be a better society. Do you think that we could be a better society than with what we have?
Oh, absolutely. It just has to, we have to move away from the greed a little bit. We have 1% that owns the majority of everything in this country and not willing to let it be impactful for other groups. But I think overall, if we could just give to those types of programs, everyone in society could then prosper. But there's certainly a need for that. If not, you're going to spend it on one end, and that's going to be in incarceration or having deviance within the society and having less of what we would want to be the model country in which we are. Yes.
You know, Dr. Sanford, you've been with us on a number of occasions, and I certainly appreciate all of the information that you have given us. But and looking down the road between now and as we move into this next